Now let's get into the OCS. Let's get into help me understand the overview of those key content areas that the OCS is actually covering. It feels like we might be cheating a little bit, but you have to know and understand the test that you're going to prepare for. So this is a good thing. It might feel like cheating, but it's not. It's just good preparation. So what are those key content areas that the OCS will quiz you on?
Well, one of the nice things with the OCS is it does try to mimic clinical practice. Naturally, if you specialize in other areas, you might see more or less of that. But even if you're going through AbTree's webpage in the description of specialty practice, they will break this down for you percentage-wise by content area and then also tested by region. So, for example, you're going to get more questions based on the lumbar spine, just based off prevalence, than oral facial pain or craniomandibular dysfunctions. So those exact percentages you can look up there, but I do have them here, so happy to share, so you don't need to go look for that. But I mean, the big areas outside of the geographic regions are going to be, you need to know your anatomy and physiology. Like everything falls back onto anatomy and physiology. You want to really know that. You'd want to be aware of things like movement science, pathology, pathophysiology, and also we see post-op and medical patients as well. So medical surgical interventions, things like that, how to rehab following those types of conditions, evaluation, diagnosis, prognosis, examination, intervention. These are things that we are doing all the time in clinical practice that you are going to then be questioned on in a standardized format to then feel that you have a strong grasp of that material and can feel confident in saying you are an expert in this subspecialty of physical therapy.
Great. Now people are going to get worried, or maybe it was just me hearing this, right? I know this might be it depends, but maybe some best practices. What study strategies or tips might you suggest for retaining and understanding this vast amount of information? I feel like that might be one barrier people might be nervous about out there. There's a lot of information. So you've done this yourself. You've helped people through this. What study strategies or tips might you suggest?
The one very good one is you aren't alone doing this. There's a lot of people that do this each and every year. It is a lot of information, and to perform optimally when that exam date comes, it is that Boy Scout model of be prepared or have that schedule laid out in advance. Know how you study and retain information. Some people are more kinesthetic. Some people are more auditory. Some people are more read, write, like repeat. Some people would want to be in small groups. Other people want larger groups. So it's not a one size fits all. It's really a knowing yourself and surrounding yourself in that type of community. Because if you're someone that does better independently or in a small group and suddenly there's 10, 12 people in a room and everyone's talking, that might not be as ideal a situation for you to try to retain that information. And then naturally, one of the best ways to feel that you have a firm grasp of the information is to teach it or create a scenario where you need to apply it. Yeah. So if you're looking at things that could be intervention or whatnot, it's, go to your coworkers, practice it. Hey, practice this. Can I show you this? Try to make it whatever makes it sink in for you. And also it is a lot. So you need to take breaks and you still need to do your own self-care. Like sleep matters. If you're someone that's an avid exerciser, that matters. Like you have to still do all of those things you need to do beyond just focus on this one test or this one task. You do want to be able to focus and devote sufficient time and attention to it, which it might rise up the order of priorities compared to other things, but you can't just neglect that other aspect of what's going on in your life.
Sure. So not just necessarily about the test. So we do want to remind people if they have questions, fire those away. We do have some people saying hi. Kathleen says she went to PT school with you, Jeff, saying hi. Yeah. Anthony from New Jersey, physical therapist. May from Tacoma, Washington. Noom saying hi to a buddy. And we'll get to some of your questions. If you're asking those in the comments below, we will get to those.